Hello, everyone. Welcome. As you came in, did people get these sheets, a blue sheet and a white sheet? No. Okay. I wonder if there's any volunteers that might want to pass them out. Thank you. Okay, so hello everyone. Welcome to the session, Careers in Pharmacy. My name is Sara Lofstrom, and I work at the University of Minnesota College of Pharmacy. I've been there for over 7 years, and my role is to be an admissions counselor and a career counselor. So for the admissions piece, my job is to help you get into our program. And then in terms of career counseling, once you're in our program, and even before, and that's part of why I'm doing this session, but my job is to help you figure out what career that you would want to have in pharmacy, and I help you get there. So I help you get that residency or that job or figure out exactly where you want to be. So that's why I wanted to do this session today, is to help get you on your path to pharmacy. And just so I can figure out who is in the room, who my audience is, how many of you are like for sure pre-pharmacy, gung-ho all the way? And how many of you are sort of undecided about what you want to do? Great. And how many of you are leaning towards a different health profession or a different profession in general, but you just decided to come to find out about pharmacy? Awesome. I am loving the variety. This is exactly what I wanted for my audience, is a little bit of everything. So I'll be going over a number of different things in this presentation. I have a wonderful volunteer that is helping to pass out some papers. So I'll just tell you the two papers that are being handed out. One is a white sheet, and at the top you'll notice that it has a link to a survey, and that survey brings you to the American Pharmacists Association Career Pathway Online Assessment. And so that is a free survey for you to use after this presentation or at any time in life. But it'll guide us through this presentation, and some of the things that you learn in this presentation might be helpful for when you're filling out that survey. But essentially you do that survey and it'll give you your top matches in pharmacy. How many people in this room have already done that survey? Okay, perfect, perfect. That's exactly what I wanted. So what I'm going to be going over today in my presentation is all of the careers that are listed on this sheet, because I know it can be confusing if you're new to pharmacy, or even if you have been interested in pharmacy for a long time. It's hard to figure out, what does this all include? What does a pharmacist do? Where can they work? So that's what I really wanted to, that's my main goal for today, is just to go over that with you and help explain that. So this sheet will be the main guide for that. And then you're also, there's these blue sheets as well, and the main part that I'm interested in is the evaluation. So if you have the blue sheet already, if you could do number 1 right now, it says, before you attended this session, how likely were you to apply to the University of Minnesota PharmD program? Because part of my main mission is just to educate you about careers in pharmacy, but my secret mission, which is not going to be secret once I tell you, but my secret mission is to get you to apply to the University of Minnesota, because it's an awesome program. That's where I work. So I want you to be in our program. So that's sort of my secret mission, so that's why I do this evaluation. And I also really appreciate your feedback. So if there's anything that I could do to become a better presenter, really appreciate that. Okay. So I think we're ready to get started, and I'm going to try to move this computer so it's a little more accessible for me. Right there. Okay, so why are we here? The first reason why I wanted to do this presentation, and I wonder, I'm just going to move this like that. There we go. First reason is for you. So I'm hoping that at the end of this presentation, it helps to solidify your decision to go into pharmacy as a career, because there are so many awesome things that you can do. In terms of admissions, when you apply to pharmacy school, and I don't know if any of you went to any of the pharmacy school panels today, but they care a lot about how much you know about pharmacy, how dedicated you are to the profession. So I'm hoping this presentation will be a springboard for you to understand the profession of pharmacy better, and therefore when you apply to pharmacy school, you're going to have a stronger application. And then the last piece is for your career in general. Like, I want you to genuinely know your options in pharmacy, and I want you to start taking steps to prepare for where you want to be in the profession. So those are the main reasons why I am doing this presentation. Okay, so this is fabulous time. I want you to just pause for a second, and maybe if you want to close your eyes, feel free. But I want you to imagine yourself 10 years from now or 20 years from now, and you are in the career of your dreams. It is fabulous. You are excited to go to work every day, and you just enjoy it. You get a lot of fulfillment out of it. So think of some things about what that looks like on a daily basis. What are some factors when you're going to work every day and you're loving it? What are some things that you're doing on a daily basis? And what are some other factors, other perks of working in that position that really make you love it? So just think about that. I'm just going to give you 10 seconds of silence. Okay, I see a lot of people concentrating. I really appreciate this. So if any of the things that you were thinking about are up on this screen, I picked out of the APHA career pathway, so the American Pharmacists Association career pathway assessment that you have on that white sheet. They have 30 critical factors, and I just picked out 15 of them to make it a little easier on us, because to have 30 up on a screen is like too many. So I picked out 15 that I thought would be good to guide our conversation today. So these are critical factors that the American Pharmacists Association have identified as crucial parts of different people's positions as pharmacists. So what I want you to do is look at this list, and I want you to pick out 5 that are extremely important to you. That would be like a part of that, I love my job. I go every day excited about. So pick out 5 and jot them down. If you have that white sheet already, jot them down on that, or if you have another piece of scrap paper, just put them down so that you can remember, because we're going to use these throughout the presentation. So pick 5 that are extremely important to you, and then we'll move on. So I'll give you 1 minute to do that. Once you've got your 5, if you want to give me a thumbs up, that way I'll know we're ready. I'll give you a 30-second warning. Picking the 5 that would be like so important. Make you feel excited to go to work. Or would be important for your family situation, your life situation. Come on in, welcome. Okay, great. I am going to move on, but keep that list because we're going to use it. Okay, so on that white sheet that you have, and if those of you that might not have the white sheet, it's okay. If there are extras, we'll get them to you. If there aren't extras, I will email it to you at any point in time. And it's also on the APHA Career Pathway website too. But anyway. So the career options that we're going to go over today are up on this screen, and they're on that white sheet. So they're categorized in these 7 areas, and we're going to go through each one so that you understand each one. So based off of my experience, I work a lot with our current pharmacy students, but I also interface a lot with our alumni and pharmacists that live in Minnesota and actually pharmacists that live all over the country. And so through my experience with these pharmacists, I decided to put this together. So this is based on my opinion and my experience with pharmacists. But I took each category and I essentially took which factors are going to be really high in that category of pharmacy careers and which ones are not going to be quite as prevalent or is not going to be as favorable, if that makes sense. So for this first career option we're going to go over, in general, you're going to have a lot of continuity of relationships. So that means you're going to have long-term relationships with people. You're going to be collaborating with other professionals. You're going to have innovative thinking as a part of your job. You're going to have applying scientific knowledge as a part of your job. And creating new knowledge with research will be a part of this job, or this career category, I should say. You'll have a lot of professional and community prestige, the way people will view you in that position. You'll have a lot of opportunities for advancement, so you don't have to stay in the same position. You'll be able to move up through the organization. You'll have a variety of daily activities, so every day will be a little bit different, or a lot different. And you'll have job security, because this is an area of pharmacy that has high demand. And you will have the ability to travel with your work, mostly to conferences, but you'll also have the ability to go on sabbatical and travel during that time. Your work schedule will be really great. You get to set your work schedule, essentially, but most people that work in this area of pharmacy will work 8 to 5 kind of schedule, Monday through Friday. Occasional weekends, but rarely on the weekends, and rarely at night. The 4 areas that probably you won't have as favorable conditions in would be interaction with patients, because in this first career area we're going to go over, your primary role is not to be a practitioner. And you won't have a lot of entrepreneurial opportunities, so there's not a lot of room for like you creating something brand new because you're within an institution already. Income and benefits in this area, and I'll just say this right away, income and benefits in pharmacy in general is great. Pharmacists make at least twice as much as I do, no matter where they are. But in this particular area we'll talk about first, they don't make quite as much as other areas. And geographic location, so if you're really wanting to only be in one specific spot, so if you want to be in Davis, California for the rest of your life, this career area might not be the best fit because you can only stay in Davis if they have a pharmacy school. So the first thing that we're talking about is academia. So I've listed on here the main areas of academia that you can go into. Academia primarily includes research and education. So your primary roles, if you're working in academia, are to educate future pharmacy students or other healthcare professionals in general, and then to focus on your own research projects. So that's in general. Here's a breakdown of all the different areas, and as I said before, working in academia is in high demand. Why? Because about 20 pharmacy schools have opened in the past 10 years. There's been an explosion of pharmacy schools, so there's a lot of faculty positions for people that graduate from pharmacy school. So I wanted to give you a few examples of what this actually looks like in a real person, because otherwise just looking at these words is not too helpful. So I wanted to introduce you to our dean of our pharmacy school at the University of Minnesota. Her name is Marilyn Speedy. And to give you a little bit of her background, she has a Bachelor of Pharmacy degree, and this is before the PharmD was normal. And then she went on to get a master's degree, and then she got her PhD in pharmacognosy. By the way, pharmacognosy, if you're wondering what that is the study of medicinal plants. And medicinal chemistry, and medicinal chemistry is essentially the area of creating its drug discovery, so creating new compounds that will become next decade's drugs, essentially. So that's where her background is. So in her position in academia, she's hitting 3 of those areas that are outlined on your sheet. She's in administration because she's the dean. So her job is to oversee everything that's happening in our College of Pharmacy, and she's essentially the boss for everybody in our whole college. So that's where you have the ability to move up, and you can be a department chair, or you can move up to assistant dean or dean of a College of Pharmacy. and then you can work in any of the departments or any of the areas. So that gives you one example. Another example is Christian Pereira. He's one of our assistant professors, and he also has a clinical practice. So this is pretty common nowadays for a lot of our PharmD faculty, that they have a part-time clinical practice and in his case, it's a primary care clinic where he sees patients one-on-one all day long. So if any of you were here for the video that I showed earlier about Tracy, that's what he does, but in a primary care clinic. And then he's a professor part-time. So in his case, he actually does have high patient interaction, but if you're just a typical run-of-the-mill faculty member, you wouldn't have as much patient interaction. And just looking at his background, so you can get an idea of what you might want to do to prepare for that kind of position. So Dean Speedy had a PhD, and then he did what's called a PGY1, postgraduate year 1 general residency, and then a postgraduate year 2 specialized residency. And that prepared him for both his clinical position and for his faculty position. Does that make sense? Cool. And then you can see the different areas that he's involved in his position in academia. He has a clinical area, experiential education, because he's a preceptor for our PharmD 4 students. And then he also is in the department in our college that focuses on pharmacy practice and making innovations and change in pharmacy practice. Cool. So we hit 1. We got 6 to go. Oh, and you know, I had this video, but I feel like we don't have enough time. I gotta keep going. But I can always, this is on our Facebook page, so check out our Facebook page and see this video. But it's essentially a PharmD student getting involved in research. So that's something that you can do at the University of Minnesota to get ready for a career in academia. Okay, so for this next one, how many people had all 5 of theirs in this blue section? Guy in the blue. Wow, that's a coincidence. And nobody else had all 5 of theirs in blue? Got one right here. Okay, so if you had all of yours in blue, or maybe just the majority of yours in blue, and maybe none of your deal breakers are in the crossed out area, then the area that might be great for you is community pharmacy. Community pharmacy is probably what you and the general public is most familiar with in pharmacy. Is go to a Walgreens, go to a CVS, go to a Target. That's community pharmacy. And while a lot of people might not have like the best impression, they might think, why would I want to work there? I just will count pills all day. Not true. Pharmacy technicians count pills. Pharmacists in a community pharmacy setting, their main role is to be managing the medications of the patients that come in, making sure there's not going to be any bad interactions, and directly counseling the patients on their medications. So community pharmacy is a fabulous place to work. If you're a community pharmacist, guess what? You're the most accessible healthcare provider there is. And that's what a lot of our community pharmacists that graduate from the University of Minnesota love about it. They love being that really accessible healthcare provider and being able to answer any general questions about people's healthcare that's within their scope of practice. So that's a great thing about community pharmacy. Some of the areas that you can go into in community pharmacy, it ranges quite a lot. You can definitely move up, so you can start as a staff pharmacist at a place, and if you want to move up in the corporate management, you can. And actually a lot of our students end up doing that because we have a leadership emphasis in our program. You can also work, keep in mind that a lot of people will open up their own pharmacy or they'll take over a different independent pharmacy, so if you don't want to work for a chain, you definitely have that option of having your own business. And working in home health care, we actually have one of our faculty members goes around with a visiting nurses association and visits patients in their home as a part of her community pharmacy practice. So there's a lot of clinical options working in community pharmacy other than dispensing medication, which is most commonly probably your experience with pharmacists in community pharmacy. Okay. So I figured that was sort of an easier one since you guys maybe already knew about community pharmacy. So let's move on to another one. So does anybody have all of theirs in pink? Got one right here, 2, okay. The guy in blue again. Okay, so if all of your critical factors are in pink, or majority of them are in pink, then this next one could be a good career match for you. If variety of daily activities isn't as important to you, then that's great. Job security might not be quite as stable in this area, and creating new knowledge via research. So let's see what it is. It's consulting. So consulting, you can work in any of these main areas. Pretty common that a consulting pharmacist, so it's sort of an open door of what you could be doing as a consultant. But oftentimes as a consultant, you're not necessarily you're not going to an office every day at the same place. Often as a consultant, you are traveling around, so that's why travel was one of the things. And you might not have necessarily like a home base, if that makes sense. One of the biggest areas of consulting that's really been growing is managed care. And managed care is something people don't always know what that means, so I wanted to help explain it. Managed care is essentially working for a managed care organization, which often comes in the form of an insurance company, or on a federal or state level, it could be the insurance provided by the state or by the country government. And essentially, you as the pharmacist, you're managing the medication care of patients in that insurance company. So you decide what medications are covered. So if you've ever gone to get something fulfilled at get your prescription filled at the local pharmacy and they say, sorry, it's not covered by your insurance. Like, what? Who made that decision? A pharmacist who works for your managed care organization did. And they made it for clinical reasons, but also for cost effectiveness. So if you're interested in using sort of a business standpoint and melding it with your clinical expertise as a pharmacist, then managed care is a great place to be. And I just wanted to show you a map of all the managed care residencies that are around the country. So this is big. A lot of people don't consider managed care because they maybe haven't heard of it. But it's actually quite a big and growing area of pharmacy. And a lot of our students at the University of Minnesota are interested in going into managed care. So I just wanted to show you, look, right there where we are, there's like a bunch of blue dots. So there's a lot of managed care residencies right here in California, also in Southern California, but you can see they're all over the country as well. So again, a residency is something you would do after pharmacy school as an optional, additional training to your PharmD. But I just wanted to open up your eyes to see that there are residencies not just in clinical aspects, but also in managed care aspects. And just so you know, managed care residencies tend to be about half and half, or at least the residents I've talked to, tend to be like part-time, like half the time is patient-based, and then the other half is more of the management behind-the-scenes business. If you're interested in going into managed care, it might be worth considering getting a PharmD MBA, Master's of Business Administration. It's not at all required, but it would help you come to that kind of a position with a business mindset. I feel like we're doing good on time. Let me just check. Okay, yeah, we have like 20 more minutes. Okay, good. Okay, so this next one. Does anybody have all of their critical factors in green? Yeah, right here. Good. Anybody else? Yeah. Okay, so for this next area that we're going to talk about, you're not going to have a lot of interaction with patients. So if that's important to you, then this is not going to be the right place for you. But if you want to be affecting what eventually happens to patients by applying your scientific knowledge, by creating research, and by the way, this area, I would say, has, in general, the highest income in pharmacy, coming out of, and I'll talk about this later, but after you're done with your training in this area, I would say starting salary would be about $175,000, and that's starting. But your work schedule is going to be pretty packed. So I would doubt you're going to be working 8 until 5 like you would if you were working in academia, have that nice schedule. Working in this area that we're going to talk about next, my guess is more like 10 to 12-hour days, might be more common. You will travel though, And geographic location is not going to be as easy for this one because it's only located primarily on the East Coast and somewhat on the West Coast. So if you want to be somewhere in between, like in Minnesota, best place ever, then it might be a little harder to work in this area unless you work for a smaller company. So what am I talking about? I'm talking about the pharmaceutical industry. And so I just put some pictures up here of some of the big pharma companies. And the main areas that you could work in a pharmaceutical industry company, you could work in administration, and one example of that is project management. And that's an example of how you can move up. Actually, we just had a pharmacist come and talk to us who works for the pharmaceutical company, and he's like third below the CEO. So he's moved up throughout the company, does a lot of project management at that company. For the business sector of the pharmaceutical industry, marketing is a very common place that a PharmD would work. And as you may have already been gathering, again, getting a PharmD MBA would be extremely helpful for working in this area of pharmacy practice, because essentially you're working for a company, and a company that wants to make a profit. And then research and development, so it's pretty common for a PharmD to work in the clinical trials and bring their clinical expertise and the patient care aspect to those clinical trials. And then there's also the scientific and technical areas of the pharmaceutical industry, and I just gave one example up here, which is regulatory affairs, and what that means is you're interfacing with the state government and the federal government to see what all the regulations are for getting that new medication on the market. So those are some examples of working in the pharmaceutical industry. If you wanted to work in the pharmaceutical industry, then you would want to do, you don't have to, but you would want to do a fellowship after pharmacy school. So a fellowship is a 1 to 2 year additional training after you have your PharmD. It's similar to, and I'll talk about this in just a little bit, a residency, which you might have heard about a residency before, but a fellowship is different in that you are working in a pharmaceutical company, and essentially they're going to rotate you around to all the different areas of that company so you can become proficient in everything that company does. And very oftentimes after you finish your fellowship, which by the way, your fellowship is paid, it's a paid experience, but you make about, I don't know, a third of what you normally would make after your fellowship. But essentially they rotate you around and you get to know the company really well, and oftentimes they will hire you after your fellowship is over. So that's what it looks like for working for the pharmaceutical industry. So this next one, you might notice it has a lot of things crossed out, and again, this is based on my own experience, and this is in general, and it can fluctuate a lot place to place, role to role that you're in. But this next one that we'll look at, work schedule probably won't be so great. You will most likely have to work nights and weekends, at least on a rotating schedule, so it might not be every night, and it might not be every weekend, but in general, you will be required to do that at least at the beginning of your career, and maybe as you move up, you won't have to as much. There's not a lot of travel with this one, and the variety of daily activities really depends on your position. Sometimes, especially if you're working in like the emergency department, yeah, you're gonna get a variety of patients every day. But what you're doing, your actual role won't change, if that makes sense. Geographic location, this next one we're talking about, you're only gonna be able to be employed where there's a big hospital, or a hospital, I should say. So you won't be able to be just anywhere. And let's see what else. Oh, so interaction with patients is huge in this one. Collaboration with other professionals is really big. So if those are important to you, you'll have high community prestige. I do have income and benefits as like the not so great area for this one, but again, you're still gonna make a great wage. You just probably won't start out at as high as you would going into community pharmacy or the pharmaceutical industry or managed care, any of the consulting. Okay, so what are we talking about? We're talking about institution. So institution, the biggest area of working in institutional pharmacy is to work in a hospital setting. But within a hospital, there's a lot of different things that you can do. You can be in administration, so you can be managing the entire pharmacy department, or you could be managing the pharmacy services for the cardiovascular and the infectious disease unit. So there's a lot of room for moving up. You can be a clinical pharmacist, and I'll be talking about that in the next slide, some of the clinical specialties that you can go into. You could be working in the distribution and control, so you could be working in that central pharmacy that provides all the medications for all the patients in the hospital, but more focused on getting the right product to the right patient. You could be working in nuclear pharmacy, so nuclear pharmacists, they usually, and this is if you like to work at night, so if you want to be up from about midnight until 7 in the morning, nuclear pharmacists, their main role is to create radioisotopes that get injected into a patient's body to diagnose cancer and other diseases. So those radioisotopes have to be created overnight because their half-life, it'll completely be disabled within a day. So, so that's a cool area if you are a night owl. Nuclear pharmacy, place to be. And then you could also be working in the outpatient pharmacy in a hospital setting. So let's go into some of the clinical areas of pharmacy that you can go into. So these are all of the clinical specialties that you have, and it's actually on your sheet back at the bottom. But if you wanted to go into any of these areas as a pharmacist and essentially have this be your clinical expertise, you would do a first-year general residency after pharmacy school. And then you do your second-year residency in a specialty area that's up here. So just like physicians specialize, pharmacists also specialize, and their specialty is in any of these areas, and their main role is to be the medication expert for these kinds of situations. Does that make sense? Okay, let me check on time. Okay, looks like we have 10 minutes. So I do have time. I'm going to show you a video just so you get a glimpse of what a clinical pharmacist's role looks like. So I'm going to show you a video of one of our graduates. His name is Richard Mulvane, and he is a cardiology specialist. So let's see. This one. Yes. And then I'll finish up with some statistics. Well, a few more areas of pharmacy and then some statistics. But this will give you a good glimpse of what a clinical pharmacist might look like.
Hi, I'm Richard Mulvane. I'm a clinical pharmacist, pharmaceutical care practitioner with the Essentia Health Heart and Vascular Center here in Duluth, Minnesota. And this is a day in the life of a pharmacist.
Hang on. Help. Who's my tech person? I think he said press F7. Are you coming to help me? F7. F7? I am pushing it. Nothing's happening. Oh. Do I go to extend? And then what? Aha. Okay. So it's supposed to go up? Still not there. This is why I have technical experts over here. Yes.
The variety of tasks that I do on a given day is varied. I have to be very flexible. One of the things that I love to do, of course, is MTM or medication therapy management. I do see patients independently. I also offer curbside consults to other encounters that are going on. Another one of the hats I wear is I am actually the heart attack program manager. We have 20 hospitals in our region that could send us heart attack patients. And so being a pharmacist, I was able to speak the language of the drugs, the doses, And recognizing that each one of these hospitals had a pharmacist there, we're able to have a unified protocol within the region for 20 hospitals. When you streamline care, outcomes become better.
My name is Nancy Hassinger. I'm an interventional cardiologist. Because Richard has taken and really made this protocol what it is, been a strong voice with the whole state trying to get a unified protocol, that consistent care for heart attack patients gets the care quicker and more consistent and really treats those patients by guideline standards so that they get the best result.
It has a ripple effect that touches, hundreds, if not thousands, of patient lives. Because you're also helping make a difference for patients that you can't even see. For example, I had a gentleman. He was rapidly moved from a very remote site to a regional hospital to our hospital in a very quick fashion. Was given all the drugs that he was supposed to be given at the right times, and got him straight to the cath lab and opened him up. And he has a new lease on life. And when that happens, it touches you right here that you made a difference. So that's fun. That's what we want to do as a pharmacist. We want to make a difference, and I have the luxury of getting to see that a lot in my practice.
All right, so you got a glimpse into clinical pharmacy. Oh. Does it matter? I don't care. Okay, so you guys saw that. All right, we have a few more areas, just 2 more areas on your sheet to go over. And actually, these ones I didn't separate out the critical factors because what you can do will vary so much. So for this second to last one, we have regulatory. And essentially, you'd be working either for your state government or your federal government. And these are some of the areas that you could work in. The majority of from the Indian Health Service up, all of those are associated with the federal government, but every state will have a Department of Health that you could work for. And all of these are located essentially, especially like Department of Veteran Affairs, you're gonna have a VA any state that you're going to be in. And then every single state on the state level will have a board of pharmacy, so you could work at the board of pharmacy. And a big part of that would be creating new legislation. So if you've heard about provider status in California, guess what? The Board of Pharmacy in California, I'm sure, was very instrumental in getting that legislation through. So those are some of the things that you can do if you want to work in the regulatory area. If you work with the Indian Health Service or with the VA, you will have a lot of patient interaction. So that's why I couldn't do that list of critical factors, is just because it's going to vary a lot if you work in a regulatory setting, how much you do and what your work schedule is like, how much you get paid. It all varies quite a lot. And then they have this category, other, everything else that didn't fit into the other areas that we've already talked about. So other can include computer technology. This is huge. I don't know if any of you were here for the keynote this morning, but one of the first keynote speaker was talking about the personal medical record of people and data and how important data is in healthcare. So pharmacists are a big part of medication data. And so having a system where all pharmacists and all healthcare providers can be able to look at a medication list of patients, like this is something we need. And if you've ever been in a hospital setting and you've seen these machines on every floor that dispense medication, pharmacists set those up. So anything having to do with technology and the use of medications, pharmacists are there. We actually have a number of students at the University of Minnesota pursuing Masters of Health Informatics because this is a big area of pharmacy, so that first one up there. You can be a part of the accreditation, so when a school is fully accredited or partially accredited or not yet accredited, there's a group of people that go around and accredit schools, essentially, and visit them and hold them to certain standards, so you could be a part of that team. There are a lot of legal aspects of pharmacy, and we actually have a graduate that testifies in court all the time because there are questions about whether a medication would make somebody legally insane or what it would actually do to somebody or not. Is it a lethal dose if they get this? So there's a lot of options for working in legal sector. Mail order has been growing quite a lot in the United States. So you could be working in a mail order. Pharmacy Association, so the second keynote speaker today works for the American Pharmacists Association. They also created that white sheet that you have. So working for a pharmacist organization like that. Specialty pharmacy, usually what they're doing is creating specialty medications for rare diseases. And then third-party insurance, pretty self-explanatory, working for a publication, so if you love to write and you're a great writer. Not just people take medications, animals do too. So you could be a veterinary pharmacist, and there's actually a veterinary pharmacy residency here at UC Davis. And then wholesale services, manufacturing of medications. So that's our other category. Let me just do a quick time check. All right, we got 3 minutes. So I wanted to give you just a breakdown of, okay, so Sarah, you told us where all these options are, but where do people actually work? So I wanted to give you this little bit of data about where pharmacists actually work. So in general, about half of all pharmacists work in community pharmacy settings currently in the United States, but that is changing, and so Minnesota's sort of on the cutting edge of like where pharmacy is going in the future. So you can see in Minnesota, more people work in a hospital setting and provide clinical services. And also that other category sort of encompasses all those other things that we talked about. That's also bigger in Minnesota. So working in managed care or regulatory affairs or consulting or different things like that is a little bit bigger in Minnesota. So that gives you a quick breakdown. In terms of our graduates from our program, about half of our graduates are going on to do a residency. We are above average in the nation. Most pharmacy schools, I would say it's less than that, but for our graduates, it's about 50%, and I foresee that within the next few years, it'll be even up to about 75% of our graduates will be doing residency. So if you have an interest in clinical pharmacy, Minnesota's the place to be. We actually have one of the highest match residency rates in the whole country. We beat UCSF. So just gonna say, if you wanna do clinical pharmacy, come to Minnesota. And then about half of our graduates go directly into employment. And then some do a fellowship and some pursue a different graduate degree. And so if you do come to the University of Minnesota, I just wanted to highlight some of the career and professional development things that we have embedded in our curriculum. So automatically, you are going to have all of these things embedded into your PharmD curriculum at the University of Minnesota. I would say that is incredibly rare compared to other pharmacy schools, and if it's important to you to have the support to get to the career that you want to be in, then you should come to the University of Minnesota. So I just want to thank you for coming to this presentation, and I do have a ton of materials up here, so if you want to grab any of them, some of them are resources to help you get ready for pharmacy school and other things about admissions. So thank you so much.